Welcome back, everyone. This is the Get Support meeting of Prevent T2, the CDC's Lifestyle Change Program. Today, we are going to talk about getting support for your healthy lifestyle. Before we begin, look at your action plan from the previous session. What went well or what didn't go so well? Let's face it, it's not easy to make lasting changes in your life. Fortunately, you don't have to do it alone. Getting support for your healthy lifestyle can help you prevent or delay type 2 diabetes. Today we will talk about how to get support from family, friends, and coworkers, groups, classes, and clubs, and professionals. And finally, we will make a new action plan. You've been working hard to make healthy changes in your lifestyle. Your family, friends, and coworkers can have a big impact on those efforts, for better or for worse. Let's start by talking about some ways that family, friends, and coworkers might get in the way of your healthy lifestyle. This is not always on purpose, but it happens. They hinder your healthy lifestyle when they buy and cook unhealthy items, complain about the healthy items you buy and cook, criticize you for failing to reach your eating and fitness goals, eat unhealthy items and offer them to you, invite you to do things that involve sitting or lying around, make it hard for you to find time to be active, refuse to do active things with you, and tell you that you're fine the way you are so you don't need to change. To support your healthy lifestyle, they could agree to do active things with you, buy and cook healthy items, eat healthy items and offer them to you, encourage you to stick to your healthy lifestyle, invite you to do active things, praise you for being active, praise the healthy items you buy and cook, or tell you you're making great progress. Your family, friends, and coworkers care about you and want you to be well, but they might not understand what you're doing or why you're doing it, or they might not know how to support your efforts. It's up to you to tell them. To get them to support your healthy lifestyle, you could share facts about type 2 diabetes and how to prevent it, tell them why you are trying to lead a healthy lifestyle, ask them nicely to support your efforts, give them regular updates on your progress, set family rules, be active with you, plan and shop for healthy meals with you, or cook and eat healthy food with you. We've talked about how to get support from family, friends, and coworkers. Now let's talk about how to get support from other people in your community. One way to get support from others in your community is to join a support group. Some support groups meet in person, others connect online. Support groups are for people who share a common issue. There are support groups for people who have lost a child, for people with cancer, and for people with a spouse who drinks too much. There are also support groups for people like you, people who want to lower the risk of type 2 diabetes and live a healthy lifestyle. Support group members share facts, ideas, and feelings. They listen to and encourage each other. Another way to get support from others in your community is to join an online health community. There are health communities for people with a range of lifestyle goals. Members share tips and stories, compete with each other, and cheer each other on. Another way to get support from others in your community is to take a class or join a club. This lets you learn about and practice healthy habits with like-minded people. Classes and clubs that support healthy eating habits include those for healthy cooking, healthy meal planning. Classes and clubs that support healthy fitness habits include those for dancing, softball, and walking. Ways to find groups, classes, and clubs that support your healthy lifestyle include asking your healthcare provider, contacting community groups, or searching online. We talked about how to get support from family, friends, and coworkers, and from others in your community. Now let's talk about how to get support from professionals. These are people who have specialized training. Please turn to How to Get Support Professionals on page 7. You could see an endocrinologist who specializes in diabetes. They can help you with the medical side of diabetes. A lifestyle coach can help you adopt and sustain healthy habits. Nutritionists and dietitians can help you with food and eating concerns. Pharmacists can talk with you about the effects of medicine. Your primary care provider is the person who most likely already referred you to the prediabetes program. He or she can help you learn more about ways to prevent the disease or refer you to other professionals. Psychologists and therapists can help you cope with thoughts, feelings, and behaviors. Recreational therapists can help you manage daily life and be involved in your community. Social workers can provide counseling and connect you to services. Or trainers and exercise physiologists can tell you how to move your body in order to be healthy. Please look at your action plan journal. Spend the next few minutes making a new action plan. Keep in mind what worked and what didn't work well for you since our last session. Are there any changes that you want to make? Also keep in mind what we discussed today about getting support. Remember to keep your action plan realistic, doable, specific, and flexible. Please look at how to get support from family, friends, and coworkers on page 5. Between now and the next session, I'd like you to complete the chart. In the left column, write some ways they hinder your healthy lifestyle. In the right column, write how you will get their support. I'd also like you to read How to Get Support, Groups, Classes, and Clubs on page 6. Think about trying some of these ideas. And as always, submit your weight and physical activity before our next session. We have come to the end of our meeting. Today we discussed getting support for your healthy lifestyle. We talked about how to get support from family, friends, and coworkers, groups, classes, and clubs, and professionals. Next time, we'll talk about eating well away from home. Thank you for coming to this session.